Currently, I am at the place where UIB students get their clinical exposure. Why UIB is so much famous. This is a lab regarding immunology. This is very crucial for the upcoming future of medicine. Hello everyone, welcome back to our channel EOCL India, and currently I am in the premises of the hospital where the university student of UIB Faculty of Medicine come there for their clinical exposure. If you will see in the background, this is the hospital, and this is one of the quite most famous hospital of Kazakhstan. You can compare it with Delhi AIIMS because this is highly futuristic, plus they have all type of equipments. And at the same time, this hospital have their branches in US, Korea, Vietnam, as well as in Kazakhstan. They have all the futuristic technologies as well as modern technologies, and the equipments imported from South Korea as well as USA. In this video, I will take you inside the hospital. I will show the machines. I will also show you the laboratories. At the same time, I will also show you the diagnostic centers. I will also introduce you all guys with some of the faculty members, and we will do a complete tour of this hospital. So let us come. Hello everyone, welcome back to UIB India. And as per your demand, like you guys were very much demanding in the comment section, I was also getting personal messages that sir, we want to take admission in UIB and please show us more about UIB. So currently I am at the place where UIB students get their clinical exposure, and this is such a huge hospital. I can't tell you guys, because once I was here, I was highly mesmerized seeing this hospital. So this is the main backbone of UIB, why UIB is so much famous. So let us come and see the hospital. Like this is the third floor of the hospital, and this is the main thing why UIB is so much famous among Indian students. So first, if I will tell you guys, this is the reception area where like a student can come and tell what is the work and why they are here. And if you will see in my right, this is the generally waiting area. Here, if you want, you can come sit, wait for your appointment, or can take a body massage. If you will go straight, you will see a dressing room, and after that, this is a body measurement room. Like for every student who comes to UIB, there is a generally body measurement which goes on, and this is for beneficial for a student because they come to know about their body. If I go straight, this is ECG room, and if you will be knowing about it or you have studied about it, it is for heart. Going straight, we find pulmonary function test room, PFT, which we call in India, and this is a blood collection room where you can go and give your sample for blood test. If I go little bit ahead, this is endoscopy center, and endoscopy is done here. Going little straight, this is the separate washroom for boys and girls, or for men and women, and this is the lift area from where you can go down or go to the other floors. If I talk about the hospital has 5 floors. The first floor and the third floor is generally for checkups. If I talk about the rest of the floors, like second floor and fourth floor, they are basically laboratories, and the fifth floor is also laboratory. This is again a dressing room here, and this is ultrasound room. Like if you will see in this hospital, you will find like for everything there are 2 to 3 specialized room. So this is another one, and this is ortho room for things related to ortho. If I go little straight, this is a hearing test room. Like if the patient is having a hearing issue, they can come to here for their hearing test. Going little straight, we find again another ultrasound room here, and after that this is GYN examination room. If you will see this is a mammography room, and this is another ultrasound room. So now we will go to the other floors, and we will also look about the other things present in the hospital, like labs and other things. Hello guys, so we have Alia with us, and she is from academic marketing team, and she will now be with us and introduce us about the various labs present here in hospital. So Alia.
So first of all, we have the 4th floor and 5th floor of the laboratory. So 4th floor consists the special immunology, microbiology, and also the molecular diagnostic. We have the 3 types of laboratories in 4th floor. So first is the special immunology. So we can see it from this side.
बेसिकली मैं इस लैब के बारे में बताऊंगा आप लोग को. बेसिकली दिस इज अ लैब रिगार्डिंग इम्यूनोलॉजी, एंड दिस इज स्पेसिफिकली फॉर द थिंग्स लाइक related to immunity. If we will go ahead.
This is the cytology.
This is a parasitology lab, and here things are related done to parasitology.
And also we have the white test here, so we can see from here. Respiratory pathogen culture we grow here, and also we have box. You can see there.
If you guys must be studying or you must be quite aware of current affairs, you might be knowing that when COVID was there, respiratory pathogens culture was highly in news, and this is very crucial for the upcoming future of medicine, because all the diseases which are currently in trend, they are related to respiratory pathogens only. So this is a very important lab which is present here.
So from here we have the microbiology part of the laboratory. So here we read and identify the type of the microorganisms here.
So we are on the molecular diagnostic part of the hospital, and so Alina will tell you more about it.
First room of our molecular diagnostic, we have the extraction room. So here we will do the extraction of DNA and RNA. You can come inside and see. So here we have actually the two zones. First of all, it's kind of, we can say, the dirty zone. Like we will use the all kind of DNA and the RNA extraction here, and also we have the second zone is for the respiratory. So how you see, we have also the boxes there. Yes. And also we have the extraction machine like Nimbus. This one is used from the USA, and also we use it in Korean and also in Kazakhstan. This is for the extraction of our DNA for the PCR. The second room is the mixing room. Here we will just do the mix and have only reagents, so we will not enter here our any DNA or RNA type. Just this we can call like clean room. Okay. So how you see, we can make the reagent mix like master mix for the PCR. That's it. So the next room is our mix we will have here, and also we will prepare our DNA for the amplification for the next step. And how you see, we also have the windows, like small holes with the windows there, you can see. So there we transfer our DNA and our samples. So how you see there, we also have the working place like the Starlet. So we're going to avoid the mistakes having by humans, right? So we're using the special working place like Starlet. So this room is for the amplification room. We call it amplification room. How you see, we have also 20 maybe type of the amplification machines like the 96, we can call it. So here we will have our amplification and the finish our PCR and have the results from the amplification machines like that. So this room is we are going to use for the different type of PCR, like the old way of PCR, but still we are not using, but we are prepared for the different type of PCR.
So as you have seen, from the starting till the end, we have a complete elaborate process, like from DNA, taking out the DNA, and after cleaning the DNA, mixing the DNA, and then checking the PCR. And they have both the conventional method as well as the automatic method, which try to eliminate all possible type of human errors. So the lab is quite modern, and like they have machines from South Korea as well as from USA, which is not, I think it is neither in India as well as this hospital is in Kazakhstan only have these machines. And at the same time, they have the highest number of PCR machines, I think also. So if you will see, they had the most modern as well as futuristic machines, and their technology is quite up to date. So you find a very elaborate process here, and the infrastructure will surely help you guys to understand the things and learn in a better way, making you future ready.